All right.
Yeah, I'm gonna see like the entire like all their little nursing influencer group at a wedding later.
I can ask my hot cousin to ask to get a drip. And
Let's go. Let's do it.
Hey, be like a or IV. I think he's actually wanted to do a comparison.
Really?
Yeah. I think I
mean, you guys do the.
I've talked with and I remember mentioning a little bit like, cause now that they're dating, like I always see him all the time.
Oh,
Wait, who's
really?
dating?
Playing like FIFA.
Oh, one of our regulars.
Yeah.
Are we allowed to say that?
I don't know.
Oh, let's
That's-
just. We can go into introducing ourselves now.
Okay, 3, 2, 1. Welcome back. Wait, no, let's do that again. 3, 2, 1. Hi, I'm Derek.
I am Matt.
Hi, I'm Ashley.
Hi, I'm Gwen.
And together we're
Drip Dialogue.
Drip Dialogues.
You did that. We did that
that
last time.
No, see,
I'm
that
learning.
should be our intro now.
Drip Dialogue.
Yeah, Drip Dialogues. And the way that we were like 3, 2, 1. Hi, I'm this, that, you know? I like it.
You get it?
We have a good episode today. We're a little bit more organized today. But before we get started, how was your guys' weekend?
Oh, dang, the weekend. It was chill. We had that wellness event. The wellness event was cool.
Shout outs to Tell Your Friends LA.
Yep.
It was
they're
fun.
dope. There's a DJ there. I got behind the booth.
Yeah.
A lot of people
Yes,
came for
that's
IVs. Yeah.
fun.
Where were you guys?
I was off from work. It's my weekend off, and I did a lot of self-care, taking care of
Nice.
chores, and hang out with friends.
You could have done some self care with
Yeah.
us. I'm just saying.
Tomorrow.
Quick, sorry to interrupt.
You good?
Pink lights or no pink lights?
Oh. Is it distracting a little bit?
No,
What it looks
Oh,
you
you-
change it whatever color you want. It's just the last podcast today was like everything was pink in here, so it was the one thing that I was like, shit, I forgot to ask you.
Oh,
Should we
maybe
try with that off?
Continuity?
continuity. I don't know. What was the last?
I mean-
episode?
No, he said last time was pink.
No,
Was
you
it
said the
pink?
last.
The
last podcast
Oh.
before us was pink.
Oh.
But then-
last time you guys just had like a neutral color.
Now let's do orange and teal.
Orange and teal? All right, so restart the opening?
I
Yeah.
guess. No,
Or
I
we just
mean-
randomly just boom.
Yeah.
Okay,
Mid-
we'll do it
mid me
again. We'll do it
talking.
again. I feel like now like it's a little bit less nervousness and anxiety. I'm lit.
Are
From
you?
what?
Life.
Oh,
dude.
okay. That's
Love
good.
that.
I didn't know. I was like,
And
what's
I
your
was like, lit
poison?
by what?
Prime.
lit too.
Shout out Prime Logan Paul.
Doesn't that thing have like a million like bad things for you or something like that? I want to say like
Canceled.
BFA. Oh yeah, my bad.
Cancel.
I'm canceled.
Wait. Is there?
Yeah.
Shit. I love it though.
Hold on.
Seriously, dude.
Toxic.
I drink it every day.
There's a toxic chemical that has like
Is this what you want here? This orange teal?
P.
How's it look?
Is it-
I like it.
Good.
I like it. Oh yeah, it looks good.
Yeah.
It makes your guys' scrubs look good.
Oh, yay.
Yeah.
Nice.
And then
Oh.
it contrasts with the orange and the
PFAs,
black
that's
and
what it
this
is.
and the
Yeah.
teal.
You
Yeah,
can
yeah.
also zoom in on that.
Cool. All right, guys. Sorry about that.
Kanchana. Ding 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 ding.
Yeah,
He's
PFAs.
like,
That's
these
what it
people are
was.
too Asian.
Yeah.
PFAs.
PFAs. I saw like a documentary about it too. It was crazy.
Okay, back on topic.
Wait.
my bad.
Okay. No, we're doing good. We're good on time.
Are
We're-
we?
Yeah, I
I'm
think.
worried.
So.
Welcome back.
Why?
On time. Because I feel like we have to film 2 now.
Yeah. No. This is gonna be like 30
Last time
minutes.
it went by so fast.
Yeah,
It
it's
did.
going by
Really?
real quick right now. Anyway. 3, 2, 1. Hello, I'm Derek,
I'm Matt.
I'm Ashley.
I'm Gwen.
and together we're
Drip
Dialogues, your
Dialogues.
favorite podcast about everything nursing related. Clock that. Ash, where were you?
I was resting because I scheduled myself Thursday, Friday, off Saturday, and then 3 in a row, Sunday, Monday, Tuesday.
I hate that for you.
Wait, you
know.
scheduled yourself that way?
Well, I guess because I needed to start because I work at 2 places, med spa and hospital. So when I was transitioning, I need to work at the hospital Sunday, Monday, Tuesday to work at my med spa. And because of the scheduling, like I just had to like do it that way.
Oh, okay. I was
Yeah.
gonna say, I was like, that sounds like a shitty schedule where like the manager just, you know, you ever feel like they just play darts? They're like, yeah, I'm gonna have them here. I'm
I
gonna have
love
them here.
my scheduler. She's so nice.
Oh, okay. Chill.
How about your other job?
Oh yeah, and then I work Wednesdays at my other job, and then I work Swift Trip in between. So some days I don't even get days off.
Damn.
Yeah.
I'll grant you plenty of days off.
No,
I
I
respect the
can't.
grind.
When Derek's like, we have low, like.
I mean, you guys see me like when I see like a
I
client
know
coming
it's
in,
like so empty.
I'm like, what the heck?
Yeah.
Like, I'm texting everyone. I'm literally sweating. I'm like, and then like, if I don't get a response in like 2 minutes, like I text everyone individually.
No,
Yeah.
really.
No.
Yeah, it's pretty bad.
I put myself.
I appreciate
Yeah,
that.
I was on there.
My bad.
My
I'm
bad.
running a lot.
I never see
Yeah.
your name.
That's because I took a quick break until the half marathon's done. Dude, this weekend too, on Sunday,
Yeah.
after I ran my half marathon, or not half, I ran 12 miles because ChatGPT wanted me to. And then, bro, I had like the principal walk again because I don't stretch. I don't believe in stretching. I probably should. I'm
You
now
don't
learning
believe in
better.
stretching?
I hate stretching.
Oh no,
dude.
I don't stretch either.
hate-
But
yeah.
to say you don't believe in it,
I mean, I
crazy.
believe in it. That's just me saying I really don't like to do it, even though I should. And now it's like, dude, I can feel my body breaking down. I'm like, because like at like mile 7, I was like, oh yeah, I could do a marathon. I could do an Ironman. Like I was like, yeah, I got all this energy.
this.
Yeah, I was like, I could do this. Then when the moment hit like mile 7.5, I was like, I'm fucked, bro. Like I'm done. Like I actually like I was like. While mid-run, I was looking up Uber prices. I was like, like maybe I should just go back.
Do you know what I feel about that too? Like at work, you know, some days you're like on a stretch and you're like, dude, I could just keep going. I could do 6 in a
Yeah.
row. And then you hit that one patient, you're like, fuck, no, I think this is the end of my nursing career.
Yeah, and then you start like after you leave the room, you start looking at like NP school applications.
No. I
Ew.
start looking at my PTs and OTs and I'm like, is there an RN to OT program? Because you guys look mad happy all
They
the
look
time.
always happy.
OT? It's only because they got good posture, dude.
I got
They're
ergonomics on
happy.
point. Yeah,
They're happy. They're always
They are.
smiling. I'm like, how fucking dare you?
I just start looking at other jobs and other specialties.
Yeah, I'm
I
like,
love. Yep, I do love OT and PT. They always during day shift. They always get the lunch vitals for me. You know what I mean?
Do
they
they?
do?
Oh yeah, because when they do that, that's what usually when they do the assessment for the patients. I'm like, hey, can you just grab the vitals? Let me know what they are. Okay, cool.
I know our PTs help like toilet the patient sometimes. Like they clean the patient after like putting them on the
Oh,
commode
yeah.
and like all
Wow.
that stuff.
They don't do vitals for their assessment.
I don't think so.
Oh what?
Wait.
At my hospital,
If
they did.
if they have to like check for orthostatics, yeah.
Yes, I was gonna say
Oh.
if they're checking orthostatic, but it's nothing like scheduled. Like, oh, I'm getting the whatever vitals for this
okay.
time.
It's not like hourly rounding.
But I love my PT OTs too. But I just be looking at like even my friend's girlfriend. She does like travel ultrasound tech.
Oh,
She makes like good money, and I'm just like,
you can make a lot. Yeah,
damn.
it's okay. You just gotta hop on the travel nursing.
No, hell no.
What?
No, why? Where would I travel to? California's the best.
No.
Other
I
parts
meant
of
like
California?
you could.
Local?
It's technically you could be considered travel nursing
50
if it's 50
50 miles.
Mm.
I don't want to go 50 miles out of here. Where's that?
50 miles. Well, from where you're at, probably Santa Monica.
Oh.
Yeah,
Yeah.
you could go. Yeah, you could go pretty far.
But then I heard that they give you like shitty assignments.
That
You gotta
is,
find the hospitals that don't. I'm at a hospital where low key they treat travelers better than
Oh, really?
staff.
Really?
Yeah. I mean,
Maybe it's just you.
no.
Because you told him about the little brown boy at night, the sharpshooter.
Oh yeah, the little handsome brown boy.
Yeah.
Talking about me. Check the last video. But you know, like they treat travelers pretty good out there, and because like they treat us pretty good, or at least like I've been having a good luck or good streak of luck with assignments. I've been able to see like some pretty crazy stuff lately. Which, speaking of which, is going to be the topic about today's episode.
Oh yeah, the
Yeah.
topic. Wow,
Yeah.
great way to tie it
Like a
in.
transition.
What
man.
would we do without
Love
Matt?
that.
That's
I
how I
know.
also.
Matt, this is your show, dude.
I'm also like, hey, speaking of which, I gotta go. Yeah,
Dang, I never know how to leave a patient's room. I'm
You gotta
just
find
like
the
there
right-
like, yeah.
Yeah.
you just gotta find the right cue. it's practice. Or sometimes I just leave mid conversation.
Or I mean, I have the phone. In day shift, we have phones. Yeah, I don't know if night shift people call you as much, but I just be like, "Hello, okay, I gotta go."
Yeah.
Oh yeah, no, I text the secure chat saying, "Oh, I'm stuck in like room ABC. Can someone call me?" And then I'm like, "Oh, Doctor, blah blah blah. Yeah, you need me? Okay, I'll be right there."
I literally, I'm just like, well, mid sentence, either me mid sentence or them mid sentence. I'll just say, "Hey, is that a fall light?" Or like, I like call light, my bad, or like fall alarm or something, or bed alarm.
And the patient's like, "I didn't hear anything."
Yeah, I don't give them a chance to hear. Yeah, I just dip. Yeah, I'm like, oh, I gotta go.
So yeah, I guess the topic is crazy nursing stories. I mean, I have plenty, but I think you guys heard some of them already, like during like orientation and all that stuff. Does anyone want to share theirs? I mean, I guess no, I have so many, but they're mostly when I was a new grad. I'm not sure if it's because like I was new and like everything was like crazy, but yeah, I did my new grad in ER, so we saw a bunch of stuff. I know you're in ER too, so you see a bunch of stuff too.
I do.
What's the craziest thing?
Okay, I have a crazy story. Like, that's my top story I could think of. So I have this patient come to the ER, and I did his initial workup, get his labs, put his vital signs, and then put him on a cardiac monitor. Left the room, and then moments later, I was at the nurse's station charting, and then all of a sudden, his heart rate was like in the 80s, and then all of a sudden, it goes up to like 110, 115, and like, I was like, what's going on? Like, he might have a change of condition. So I came into the room, checked on him, and guess what? This guy was on his phone watching porn. And I'm like, I just came in to check on you, make sure you're okay. And he was like, can I have some privacy?
He was totally
That's
freaked out.
Just freaky, bro.
At least he was okay, right?
Yeah.
80s to 110.
He's okay, but goddamn, he's freaky, bro.
Is your ER like private rooms, or like are they curtains, or like?
That ER is curtain, so there was another patient next to his bed.
Oh, he's not getting privacy for sure.
Oh yeah, no. Was the audio on at least?
Yeah.
Oh, shit.
Loud? Was that
Oh,
loud?
it wasn't that loud, but still.
Dang, I wonder. I mean, to pass the time, I guess.
How
in
old was the
ER.
patient?
He was in his 50s.
Oh yeah, they're all.
They're freaked out.
I feel like once they get to a certain age, they're not as freaky. I mean, they're
Yeah.
freaky, but not like that freaky,
like
you know?
that.
Like, not bold like that. I've had patients do that too, actually. I think I have to look for it,
Mm-hmm.
but I actually have, like, you know, I was, like, kind of, like, recording up in the air, so you can't see anything. There's nothing for the hospital to see or anything, but
Yeah.
you could hear what my patient is listening to, and it's something about how to enhance, like, the length of your penis.
Oh.
Yeah, I was like, yeah, I ain't gonna do vitals right now. I said, I'll go in later, dude.
Maybe he just had a moment where like you guys were doing some care on him, and he was like, "Damn, is my dick small?"
I don't know,
It's
man.
like just like
He was in-
how I look good for the CNA right here.
Bruh, I'm Asian. He ain't gotta compete too hard, bro. Like,
Hey,
my bad. I'm gonna get
that's
canceled.
fair.
I know, my
Yeah,
bad.
yeah, yeah.
I'm just kidding, my bad. I'm gonna get canceled. Nah, but I mean, patients are kind of bold when they like do stuff like that.
Yeah.
I mean,
Yeah.
there are just people for it. There's strange people who do things, so we just see them all.
Oh, they're just
Right?
people.
It's all
Yeah.
different.
That
That's
or
why
like older. Oh, sorry. Older like man with like dementia. Also, like they're
They're
pretty
bold too. They're the boldest because
They
they
are
don't
the
know
boldest.
anything. They don't understand boundaries, or they forgot what boundaries are.
Mhm.
Yeah, no, I feel like the craziest stories are always like the really grody and like freaked out ones. And they're always in the ER for me. So I remember when I was a new grad, I was assigned to this one patient in one of our private rooms. It was our GYN room, but we used it for like holding patients on 5150s. And my charge was like, "Oh, hey, you're new, you need the experience. I'm like, what do you mean? Okay, well, she's a psych patient and we have security in there and she's a 5150 and just do your assessment and all that stuff. I didn't give you any other patients, so just focus on her because like she's really like crazy. I'm like, all right, cool, whatever, blah, blah, blah. I knock on the door and then the security guy came out and he was sweating. He had beads of sweat coming down. I'm like, oh, bro, what's going on? Like, are you like restraining her or something? I'm like, it's not sweat, bro. It's not sweat. I'm like, what do you mean? So I come in, I knock, and it was this girl having like some sort of manic episode, and she was just fingering herself and sort of flicking her pussy juice on the wall, and the security guard got splashed by this woman's juices, and I was like, oh, this is crazy. So I went to, funnily enough, Dr. Moy, who's our medical director for Swift Drip, and I was like, okay, something needs to, I mean, either restrain her or like physically or chemically restrain her because this is crazy. And then she's like, oh, okay, so you met so and so. I'm like, oh, you know her? Like, oh yeah, she's here all the time. And I'm like, oh, okay, all right, just give her Haldol, IM, blah, blah, blah. So I go in there and I'm like, okay, I talk to my preceptor. I'm like, okay, so it's a 18 gauge IM needle. We probably don't want to do the delta. Like, no, it has to be like the glute. I'm like, all right, cool. All right, ma'am, my name is Derek. I'm going to give you your medication so you could calm down because this behavior is inappropriate. And then I like to dictate my care. And I'm saying, all right, so I'm going to go ahead and administer this in your glute. And then she looks back at me and she's like, yeah, I like it in the ass. I'm like, so I just, gave her the Haldol. It worked. We sent her to inpatient psych facility, and that is top 3 craziest moments of my new grad residency, and it will be forever etched in my memory.
Yeah, you described that so well. I feel like it's etched in my memory now.
Yeah. Was I
so
there?
vivid.
Yeah, it was very vivid. Oh my god, damn, bro, that poor security guard.
Yeah, no, I remember how she
Or
looks
maybe
like
he
and
liked
everything.
it.
No,
It don't sound like he liked
can you
it.
imagine?
When he came out, it don't sound like he liked it.
Cause I knocked like
Some dudes would, but oh man,
maybe he's freaked out,
bro. Yeah, he's freaked out. He freaked off, bro. From that, he's freaked off
Oh,
for
it's a
sure,
it's a
100%.
freak off, dude.
Dude, psych patients win with that 100%.
She was literally like,
Oh my god.
They have no fear. They have nothing to lose. Like, that's the scariest patients. My psych rotations were my least favorite for sure.
They're a little. It can be scary sometimes too, because I'm always intrigued though, like, because sometimes there's people who go to the ER and they're still kind of like, they're still kind of going through that like manic episode.
Mm-hmm.
But I always wonder, it's like when you have those ER patients who come in and they're like either 5150 or like they are manic, and then the moment they get there, they're super chill. But what took for them to pass that was like they had to like either like cut off their boyfriend's fingers or something, or like, they had to do some kind of crazy thing to jump past that threshold, and then they were chill. It's like, whoa, it's like, what are you going through in order to even get to that point, It's kind of scary.
it's actually, I mean, it's really interesting too.
Oh,
like,
yeah,
you just
for
sort of,
It is. Yeah.
Yeah.
it's like, how do you de-escalate? Like, I mean, there's definitely several steps before getting your fingers chopped off to de-escalate, but then it went there.
Yeah. I was going to say, I was like, I know somebody who got stabbed, like, from their significant other, and then once they got stabbed, I was like, then they were chill. I was like, that kind
Wow.
of sucks. Now you're both going to the ER, like, but one for, like, something else. But anyone, Ashley, you have any crazy stories that you've seen so far? As a new grad already, too. You got anything
I feel
crazy?
like I feel like everything's just kind of like,
Everything's crazy.
well, whatever.
Really? You're there already? You're like,
I'm just like, what am I? All right, this is today. I guess this is my like intro to whatever. But
oh, you chose this life.
yeah, I guess like some of my, I don't know. It's mainly when like older men are like kind of hitting on you. This is like from my home health days when I was a hospice home health aide, and I would visit homes like in the middle of nowhere. Like, it's like on the way to Palm Springs. I don't even remember the name, but I remember I was like doing a bed bath for a patient. He's just like, take off your mask. What kind of Oriental are you?
Oh.
And he's all like, yeah. And I was like, oh, I'm the Chinese guy.
I'm the Chinese guy.
yeah. And he's like, take off your mask. Let me see your face. And
I mean,
was
it's
like,
probably because they're dying and they have like nothing to lose. You know what I
Probably.
mean?
yeah, I don't know. And like, I'm
Damn.
still like, I have to like clean his dick and everything, you know?
Mhm.
And he's just like staring at me. He's like, I bet you look good under that mask.
Oh my
and I'm
gosh.
just like,
Make eye contact.
I'm
Oh
like,
no.
I'm like over here, like, okay, so now I'm gonna, and I haven't even gotten to his dick yet. You know, he just started. I started at the top, so now I'm like, now I have to like touch your dick, and you're like saying these things.
Wait.
Wait, wait.
You're like, man, you made it awkward at the very start. Like right off the rip, dude.
Yeah, like I wish he did it at the end because I could have been like,
'Cause then
okay,
you could
I'm
dip,
done,
yeah.
bye. But yeah, and he's like, yeah,
This
he's
is
just
when you were,
watching me like, yeah.
Golly.
Damn. Back to that whole got nothing to lose, but
Yeah.
dang, bro.
All men
All
are
right.
trash.
Well, you don't do that no more, right?
I mean,
don't do that
I've
job
also
anymore?
had patients who do like they have to do Foley care, but you know how if they're a little bit more independent, you encourage them like, no, you can do it yourself because they're not supposed to be relying on you. And I had patient literally arms like this, like he can move, and he would be like, no, I want you to clean it.
With a Foley in? Did
With
that
a
even feel
Foley
good?
in.
Well, actually, no. I could speak on this. Not that I've had a Foley in
Oh,
and
okay.
had Foley care performed on me. But, okay, this is probably the closest I'll get canceled because of what I'm about to say. And I'm probably going to edit this out. Maybe. Who knows? Anyway, so like I said, I could speak on that. Does it feel good to do Foley care when you have a Foley in it? Okay, so I wasn't the nurse taking care of this patient who had bladder obstruction or urinary obstruction, right? It was one of my, well, she's a friend now, but she was my preceptee. And I'm like, okay, Foley care, CHG, you know, you want to make sure there's no crust around like the meatus and all that stuff. Patient had Down syndrome, and he enjoyed it so much that he came around the Foley.
Gotta clip that. You gotta clip that face.
It's a meme right there.
Your eyes
Bro, you
rolled
seen
back.
some freaky ass
I
shit,
know,
dude. What
yeah,
the
why-
fuck?
where
Why are
did
these stories
you-
like?
I
That's why I chose the
Crazy.
topic.
I mean, valid topic, but oh
so-
man,
He came
These-
around the Foley.
Yeah.
these
But you see,
images,
like,
though.
for me, that
cursed.
wouldn't, like, bother me as much because, you know, I don't know. Like, I just don't know how their development is, like, how aware, you know, of, like, social circumstances, or sometimes, I don't know, like,
Sure.
it just may be, you know, whatever they're going through. But this guy was, like, a guy with normal amount of whatever, and he was just, like,
He has no
Oh,
excuse.
yeah.
yeah.
You know?
Yeah.
I feel bad that you
Because-
go through that. Like
yeah.
that
That still sucks, yeah.
girl
And that's-
nurses go through a lot of this.
It's
it seems
common
like.
though, like they put their hand where they can touch your butt, you know, and
It's like
there's
this,
just
Oh.
yeah.
it's the same
Oh,
energy
yeah.
as like being at the club and then like there's these guys
Yes.
that like
Yeah.
yeah, they do
100%.
it.
Being like a weirdo on some weirdo
Yeah.
stuff.
They pull out their phone, like taking picture while you're like, doing
Yeah.
like patient care,
I've
starting their
had-
IVs. Like,
Yeah.
what are you doing?
Oh yeah, I always tell like my female coworkers, I'm always like, hey, they being weirdos, like send me in instead. I've for sure like I've walked in like, oh sir, I'm gonna be the one doing your Foley care. Oh
Oh.
man, yeah, they hella get mad. They're like, all right, whatever, and then it's quick because they don't want it. I don't want
Yeah.
it,
Yeah.
but it's gotta be done.
No,
Sorry,
like,
buddy.
I've gone into a patient's room. It's not even my patient. It's the other one. And I just go and grab like paper towel or something. And then I walk back to my side for my patient side, and I hear him on his phone. He goes, "They got some fine ass Asian women here," and I'm just like, okay.
Thank you? Question mark?
Thank you.
Yeah.
So like,
Thank you, I guess.
and he was just like, yeah, all of them. He's like, some of them don't really speak that good English though. But he's like, but you know, I don't mind that. And I'm just like,
Dang, that
I'm
dude
just
don't
like,
care.
oh, okay.
Thank you.
I'm all open. He's open-minded.
Open-minded is
Open-minded?
crazy, dude. Yeah, man. I was gonna say, I'm surprised it hasn't been said yet. With like, especially with how your stories have been going on and like your ER days. Y'all ever seen like a dildo in the X-ray?
Oh,
No? And then the
I mean,
patient's
we should have
like,
some rad techs or like radiologists
bro,
on.
no, like I remember one time like you check, like I was, we called a KUB for the patient. Just like, hey, he's got like abdominal pain. This is like already in like they're already on the floor too. So then get KUB, we check. Me and the X-ray tech look at, because I like to look at the X-rays too, because I like to practice like kind of interpreting also. Mm-hmm. So then I look, and we both look, and we're like, bro, that looked like a dildo. Like we're just, Sure enough, yeah, there was a dildo. I've also seen I've seen a lighter in someone's stomach before. That one's crazy. And then
like he swallowed the lighter?
He swallowed a lighter,
I
yeah.
see.
The dude swallowed a lighter.
I thought he went the other way.
Oh,
Oh
me
no,
too.
yeah. He swallowed a lighter.
Was it? Oh, and also, was the dildo in the rectum or like?
Dildo's in the rectum for sure. Like it
Wow.
was in the rectum, but kind of far in, bro. Like we talking about that thing, low key, look like it's like bowel perfing up in there, you know.
Shoot.
But
I was about to say a little bit of Go Lightly, and you could just,
just little
Or you
lube
could
right
digitally
there.
remove it like I
Digitally
did.
remo-
Oh, yeah.
Oh, dude, they gonna like that one for sure. They're gonna turn to Derek's patient. They like it in the back, you know.
Yeah.
That was
No,
crazy.
this old lady was, I mean, she was really grateful, but digitally removed a bunch
Have
of
you seen the
shit.
X-ray
yeah,
with the labubu in the rectum?
Oh
Ain't
my
no way, dude. They
God.
slip and fell on it.
No way.
You slip and fall,
They
exactly.
slip and fell on it. That's crazy.
Hold on, let me see. It could be a meme. And it was you
Would
can go
it go
ahead.
in,
I'm
would
looking
it
for
go
it.
in easily? Like,
100% no, bro. You see those motherfuckers? Those things look evil as hell. I think that's the lore behind them, right? They're mischievous. They're like Sour Patch Kids.
are they? Oh, is
Yeah,
that
they're
the
like sour,
lore?
like they're really sour
No, I
but
didn't
also sweet.
know.
But they look
Yeah.
like they like for sure they look like.
Is
Why
that
the
real?
hell is it like? It's like standing so menacingly, dude. Like it looks like it's about to pull up and like fight me.
I'm not sure if it's real, but
That's just gotta be fake. It's AI.
Yeah,
AI is
I
kinda
don't know.
crazy. It's got
kinda,
AI.
The way it's like
I don't know.
sitting
Like,
so perfectly in the middle, like I don't think so.
I feel like it's AI. It's gotta be AI.
I
It's
want
got to
believe
be.
it. Though. I want to believe it.
I'm sure somewhere, someone somewhere probably tried
Oh,
or got
100%.
close, or maybe that is a real person because
There's probably
all types of people.
Yeah, there's probably somebody out there who did it, but it's probably not online. That's the thing about some of these medical stuff, and that's what is kind of cool about crazy stories, but also sucks is that like only in nursing can you relate because, I mean, obviously due to like HIPAA and stuff, this is the only job where like a lot of stuff that like you really had to be there to see it, and you really can't show anyone else unless it's like unless you're willing to lose your job or it's like part of the care for the patient, you know. So that's what's kind of cool about nursing, I will say. That's actually why I like nursing. I like the crazy stuff. I like this.
Yeah.
Yeah,
Some
like-
story that like you will never forget.
Yeah.
Yeah.
Yeah, like the stories, it's like, yeah, like I can't even make this shit up if I wanted to, bro.
I only recount my stories with such vivid detail because I internalize it and I have no one to talk to about this. You know
Oh,
what I
yeah.
mean? So like
Yeah.
being in a room full of nurses, you guys get it. Like this is like it's crazy, right? Like you wouldn't bring this up like to a lay person or like just to your non-nursing friends. I feel like.
Yeah. I mean, there's already memes about like what like there's like the meme is the whole like the nurse tries to talk about their week, like how we did in the beginning,
Uh-huh.
to like maybe somebody who works in like finance or maybe someone who works like like I don't know, like biz or finance, business, same thing. But like other jobs that aren't in medicine, it's like you can't really have somebody to relate to unless they also been through that. So there's almost like an isolation sometimes.
Mm-hmm.
So I mean, I feel like that could kind of lead to a burnout a little bit. What do you think?
I think that'd be a great topic for another podcast. Burnout. Yeah.
But speaking of things that like, the crazy things that happen, did you guys hear about that TikTok of like, I think it's an OB-GYN clinic or something, of the nurses posing of like, I think it's is it the gel, the ultrasound gel?
I'm not sure if it's
something?
ultrasound gel or it's actual. What do you call that?
Like
What do
bodily
you called
fluid.
it? What do you
Is that-
called it earlier?
Pussy juice.
Yeah,
Is it though?
I
Or
thought
is
it was that.
because why would so many females? I feel like it has to do. Well, there's vaginal ultrasounds,
Right.
so it could be like from doing that. I don't know. Why would patients just be?
Just be creaming all over.
I don't know. I don't.
It was
I've
kind of a
never-
weird thing in
that's
general
not a
to
common
post.
thing. I don't feel like for women. I've been to the.
But I saw that. I saw first the TikTok, and then I saw that those nurses got fired, or those
Yeah.
healthcare workers all
Then-
got fired.
Yeah, the
Yeah,
entire
I
clinic.
saw
Yeah, it was
that.
kind of
People
like.
ask me about it
ooh.
all the time.
Really?
Because I'm a nurse. Because they'll be like, "Dude, did you see that?" And they ask me for my opinion.
It's crazy.
It
Crazy.
is of
freaking
bad
post.
taste. I feel like
Yeah.
I think it's.
it's
I
not
mean,
HIPAA violation. I don't think.
It's not HIPAA, but it's kind of like these women go in thinking they're going in for like a thing that they can't. It's out of their control. Like you can see so many women do it, and you're just like making it funny.
Right. Yeah.
You're like doing this above it.
You're making a
Yeah.
mockery out of
Yeah,
like
it's
you
just
know.
like-
'Cause what if
Yeah.
they have like those women, like they find out they have like some sort of cervical CA,
Yeah.
Yeah.
and now you're making fun.
So you're
'Cause I-
humiliating it.
Yeah, because
Yeah.
I've been to the OB-GYN, gotten my like, I don't know, pap smear and stuff, and there's some fluid, I guess, but I don't know.
Yeah, no, it was kind of a
Yeah.
crazy thing. I mean, I've definitely, I've definitely seen some crazy stuff on Instagram and TikTok in terms of nursing, but that's definitely up there. I was just like, ooh, like,
Yeah, no, there's a fine line between like using humor to cope with like the stress of the like healthcare setting and your workplace, but then things said shouldn't be like publicized. Like things that
Yeah.
are said in private really shouldn't be publicized,
Yeah.
because like that could be like their little inside joke to themselves, but you shouldn't have
Put it.
publicize all that stuff.
Yeah, I mean, how have us done anything that we're like, oh, we could have gotten fired for?
not to that degree.
Yeah, no.
We're all thinking.
I know. I was like,
I'm
I can't
thinking,
think
and I'm
about it.
like,
I
I'm
think
sure,
it was-
and then I'm like, should I talk about it?
I'm like,
I think I've been no, I don't. I think the closest is like, obviously like I said, like sometimes I record, but like it's just straight.
Oh,
up.
I see. Yeah. No,
So,
no.
but
I've done
those
that
are just
too.
like if you just hear what the fuck is going on the outside, then it's like that's kind of like what's going on. Then the rest is like up to whatever. I would never record a patient themselves,
Yeah.
but a lot of people do online. It's kind of crazy.
yeah.
It's kind of
I
wild.
think one
Yeah.
lady was like,
Live streaming.
streaming.
Yeah,
Oh,
that one was
shit.
funny.
Oh my
While
God,
she's
that
passing meds.
yeah, and like she was telling people, she had the audacity to be like, damn, she's gonna comment on this podcast, but she had the audacity to be like, you can't even see the patients, this or that, like chill out, people, or whatever. But it's like,
That reminds me of that healthcare aide, home health healthcare aide, like somewhere in the South, where she was like violating these persons with needs by like recording herself like lap dancing on them.
Oh.
Yeah, and she's wearing like those well, not. I mean, she's wearing scrubs, and yeah, no, it was bad. She got arrested.
Oh my gosh.
Yeah.
yeah,
That's kind of valid.
Yeah,
I would say that's a valid reason for.
But when I saw it, I was like, "What the fuck?"
Yeah.
And I laughed, but I'm like, "That sucks. That's not good."
Yeah.
I mean, you always got someone who's like freaked out from the opposite spectrum, right?
I mean, yeah, you're freaked out.
From like the nursing side rather than the patient side.
Yeah, yeah. Some nurses are freaked out. I mean, do you believe in the red flag that you shouldn't date nurses?
Nah. Well,
See,
how do you guys
saw-
feel about it? How do you guys feel about it?
I've heard stories like they say like, oh, because nurses. I heard specifically night shift nurses though. Luckily, I work days, but like at night, I guess you don't have much people to talk to. It's not. I don't want to say as busy, but kind of. It's not as crowded at night, and so you kind of may bond with whoever nurses or whatever doctors, whatever techs.
Coworker.
Yeah.
Yeah.
I was a night shift for like 11 years before I transitioned to day shift, and what I've learned, at least in the med-surg setting, is that on day shift, for some reason, even though you're so busy, I feel like you get to know your patients a little bit better. But on night shift, you get to know your colleagues a lot better.
Yeah.
And to what you said, it's because like you're conversing with like your colleagues all the time. And I guess to also talk about how night shift nurses could be potentially more red flagged, I guess. I feel like when you're in closed quarters with like other people and it's like late at night, I'm sure things could get a little freaked out.
Yeah.
It could lead there. I'm not
I
saying
mean,
it always
yeah,
does.
it gets into like you might talk about some issues you're having. and-
Yeah, like
Or
That's-
bonding, trauma
Yeah.
dumbing, emotionally bonding. So
Yeah.
Right, yeah, trauma. Yeah, exactly. Yeah, absolutely. I see that all the time. Yeah, and plus you guys are like in like your intimate space because like if you're doing like 2 a.m.
Patient bath together.
Yeah, or central line dressing change where
Your
you're
hand
like sort of
touches,
bending.
one for the same wipes.
It'd be so funny though if the patient hand also touches.
All three.
You're just like,
One,
locked
two,
eyes.
three. See more.
Exactly. Eye
eye
contact.
contacts.
yeah.
Dirty utility.
Yeah.
And that's how I met your mother.
It's love at first wet wipe touch. Nah, that's true. I feel like yeah, I feel
Yeah, defend
like
yourself right now, Matt.
huh?
Defend yourself.
I know, yeah, here's a night shift. I was like, oh my God.
I still feel like a night shifter.
Yeah, I mean, a night shift, I still don't understand. Like, I'm trying to just, like, at least for me, though, like, I actually walk around a lot, like, just kind of, like, roaming the halls and stuff. Like, as long as
Thinking
my
about
patient...
your ex.
Huh? Oh, nah.
We're gonna bring it up.
Nah,
Bleep it out.
nah, but, what's it called? Yeah, no, like, I walk around the hall, so I can't even imagine, like, having time to do that. But I know, you know, the Grey's Anatomy stereotype especially too. Like I know some people who are kind of freaked out with nursing and stuff. And then you're right, like the whole like trouble at home kind of thing. And then like work wife, work husband.
Oh, we gotta
They're
talk
like,
about
oh,
that
that's
too. I
little-
mean, well, we don't have to talk about that, but
Touch base on that.
touch base, yeah. it's
next couple
just-
of episodes, then.
It's kind of a, I don't know. For me, I do like to get to know my coworkers, but more like, I ask random questions. Like some of the nurses who have been there for like 40 plus years, like maybe at the start of the hospital, like I'm always like, "Do you have a daughter? Would you let me date her?" Like that's always my. And then some of them are like, "No." I'm like, "Why? I help you with turns all the time out there. What? I'm always there when you need a heparin witness, when you need an insulin witness."
Yeah,
You
they're
need
gonna be like,
waste.
Yeah, when you need medways, I'm always there. You want to let me date your daughter?
no, they're gonna be like, cause you're everywhere with every girl helping them turn.
Oh, that's a good one.
I just dug my hole deeper, dude.
Yeah.
Nah, I don't play like that. At work, I'm just like, nah. But I mean, that's how I feel like the red flag for nursing, in terms of dating a nurse, it's not really true. Maybe so. Depends on the specialty.
Oh.
Yeah, probably depends on specialty.
I guess that's true. Cause
Yeah.
Med-Surg Shelly, I ain't got the time.
I ain't got no time, bro. They're hitting that
There's no way.
spam that call light button. Yeah, dead ass, dude.
Yeah, I'm like.
ER too. It's busy.
ER? I heard ER, that's where it happens the most, though. That's what they're saying statistically.
Well, to be honest, I have seen it
Oh,
I haven't seen it.
on my unit.
yeah, I've only seen it once on Med-Surg Telly where
Mhm.
just two nurses, they walked away and I'm like,
Oh.
bro,
Yeah.
I haven't seen them in like 3 hours. Where the fuck
Can you
are
guys
they?
be any more obvious?
Yeah, exactly. I'm like,
Taking breaks together and all that.
exactly, yeah.
I don't know where they're finding the time because really, I don't know.
That
But
30-minute
everyone on my
break, though.
unit is great. Like everyone's coupled up and there are no like weird vibes ever.
Well, I guess that's one form of de-stressing, right? At work.
Self care.
Self-care.
De-stress on your coworkers, crazy. Oh.
On that lovely note, that was our episode.
I can't
We'll see
get
you next
rid of that
time.
heat.
We're Drip Dialogues.
Yes.
Drip,
Yes.
no.
Oh no. And cut.
Good. Yay.
Dude,
Went by really fast.
It
That's why I feel
does,
like
yeah.
I wonder if there's enough time because like or maybe next time start earlier. That way there's more leeway to cut things out, or else like if you cut things out, it might be like 30 minutes.
Yeah.
I mean, I'm fine with
Gotta-
30-minute episodes.
Gotta
too.
leave in the X bit.
Bro, hell no, dude. My
Give
ex
Matt,
is crazy.
give Matt his chance. He
Dude,
been
oh
missing her.
no. That one, it's bad, bro. It's a running gag. Well, we can make a running gag, but hell no, bro.
But-
My ex
No,
kind of
no,
fucked
yeah.
me up.
But
dude.
my boyfriend, he always when he started dating me, he was like, God, I gotta be with a nurse. Like,